to scan around on that slide and look for the corpora cavernosa. The other demonstration is the retina. That's fair game for the lab practical next week. I have a pointer on the layer of rods and cones. Take a look at that, and after everybody's looked at that slide, feel free to go back and scan around that. Yes?
You turn your mic up a little bit.
Got it up quite a ways. Is that better? How about now? A little better? Yeah. Okay, after you look at that, look at the retina. Feel free to scan around on that slide. It's very well done. It's an entire eyeball. Those are very difficult to section, fix and section well. So take a look at that. Okay, for the male reproductive system, there are essentially 4 slides to look at. Unfortunately, we do not have a slide of the seminal vesicle. So we have testes here. This is a plastic section from the monkey, and right out there, that's the tunica albuginea. Rather substantial. And really, we only have a portion of the testes here, but we have another slide we'll look at. So you can see all the septa that divided up, and these are all the seminiferous tubules. And as we go down to the high dry, you can begin to identify some of the cells. Now, don't try to identify every single cell that you see. Find a nice example of a spermatogonium. We will not try to differentiate between A and B spermatogonia. Look for a primary spermatocyte, and then spermatids. You probably will not see a secondary spermatocyte. So as we look around on this slide, well, right off the bat, we can see a number of primary spermatocytes right there. And you can tell because you see those chromosomes in that first meiotic prophase. And we see some spermatids in this slide going all the way out to the adluminal compartment. Now the Sertoli cells we'll identify by just simply finding their nuclei. So there's a Sertoli cell nucleus right there, prominent nucleolus. They tend to be folded at times, kind of ovoid, and doesn't look like anything else within the seminiferous tubule. So as we kind of scan around here, there's another Sertoli cell nucleus, and then we have a spermatogonium right there, directly applied to the basal lamina surrounding the seminiferous tubule. There's another one right there. So spermatogonium, primary spermatocytes, Sertoli cells, and then certainly these out here would be early spermatids. But as you go on to another, well, here's an adjacent seminiferous tubule. We see those same cells, but we also see more mature spermatids. Those nuclei are becoming oval, and you can actually see in some of these the axonemes developing coming off the base of that kind of oval nucleus. And we've got more spermatogonia right there, and also right there. Well, in between all of those, in the connective tissue septa, you'll find the interstitial cells of Leydig. There's one right there. They tend to be found in clusters, and they'll be fairly large, and you may see some secretory granules in the cytoplasm. So there's a couple right there. Otherwise, you'll see characteristic cells of the connective tissue. And there's some more cells of Leydig right there. Okay, this actually I think is the better slide to look at for spermatogenesis. But we have another slide that also shows pretty much the entire testes plus the epididymis. Now this one is stained with iron hematoxylin. And you can find all the same structures in the seminiferous tubules, but I think they're a little bit easier to find on that plastic section. So as we look at these with the high dry, we can identify those primary spermatocytes. Here we have some mature spermatozoa in the lumen. You see spermatids. And Sertoli cell nuclei, not quite as distinctive. Looks like there's one right there. But this slide tends to have nice clusters of Leydig cells, as we see right there. And we see that tunica albuginea out here. See some blood vessels. And as we go towards the other side, here is a septum, and if we follow those septa that look somewhat straight, that'll lead us right up to the mediastinum testes. And that's that dilated portion of the tunica albuginea. Now all of these that we see here, those are blood vessels. But right over here, there's the epididymis. Now in some of these slides, you can find the reed testes as well. Don't have it on this particular slide. So as we look at the epididymis, we have a pseudostratified columnar epithelium with stereocilia, which of course are non-modal. They're just kind of extra long microvilli, kind of wispy looking. But we can tell that this is a pseudostratified epithelium because there are some basal cells. One right there. Not as many as you'd see in respiratory epithelium. And there's quite a bit of connective tissue surrounding that. Okay, so there's the epididymis. Question might be asked in the lab practical to identify the organ. If it's on this field right here, it would be epididymis. Of course, we tell you not to move the slide. These would be seminiferous tubules. That would be more or less a structure. The entire thing would be the testes. Okay, and then a little branch of the seminiferous tubule, or the epididymis out here. Okay, so the next slide would be the vas deferens, or the ductus deferens. And this is going to be fairly small. You should look at this and then also look at your reader at the same time. So we have quite a muscular wall with a relatively small lumen, depending on which portion of the seminiferous tubule your section is taken from. We have 3 layers of muscle. There is an inner circular, an inner longitudinal layer, a middle circular layer, and then an outer longitudinal layer. You may not see all 3 layers. And in this case, the lining is a pseudostratified columnar epithelium. So the mucosa here is rather thin, and we just have the epithelium and also the lamina propria. Now, fortunately for you, we have only the prostate and not seminal vesicle. Those two are kind of tough to tell apart. And as we look at this slide, kind of an irregular section just taken from a chunk of prostate, see a number of different vacuoles or lumen here, has a fibromuscular coat. And as we come down, the epithelium on most of these slides is not quite as well preserved as one would hope, but we can certainly tell right off the bat that this is prostate because those are the prostatic concretions, the corpora amylacea. And they tend to have this kind of layered appearance. So we have a number of those in this individual. So this came from a rather old person. Those tend to build up with time. Okay, so that's prostate. Things to identify on here would be the prostatic concretions and then be able to identify it as an organ. Okay, so that's what we have in store for today. Thursday, we'll do the female reproductive system. I will have a slide of the corpus luteum up. Make sure that you look at that. And also the stages of the uterine cycle. And also we'll be looking at the ovary and looking at the different stages in there. Okay, so let's go ahead and get started.